right? I mean, it's like it
Yeah.
would be, but you having the knowledge and the, you know, the adjustments, and you can, I mean, I just can't even imagine. Like, I would love to like shadow you for a day and just like, oh my God, I
Yeah.
can't believe you just did that. But
It was funny reaching out in Georgia, making connections with local physicians. One of the OBs there, they had, they were busy. I met them during lunch, and the only question he asked me was, "Are you scared to touch pregnant women?" I was like, "No." He's like, "Awesome. I'll send people your way."
there you go. Yeah.
Because there's such a need, and there's, again, a huge gap that needs to be filled. So yeah, I love it. It's this morning even. I had three pregnant women, a golfer, I had a special forces guy that we were working on. I mean, my schedule is just so cool. I had a 9-week-old baby. It's just ever
Wow.
changing.
That is crazy. Yeah, so
So,
obviously we're going to focus more on golfers, or I mean just athletes, I think, right? I mean,
yeah.
we want to spend time talking about, human movement and everything that we're trying to do, like, supporting what we do, and then obviously learning from what you do on your side. Go a little deeper into what you learned at TPI, because it's always interesting for somebody on the outside kind of looking in, and don't be afraid to like criticize like what we're doing as far as teachers go, because we can always use the help. But like, give me like your bullet points of like what you really learned, what surprised you, and what that entails as far as like the medical certification.
I think the biggest thing is, what didn't I learn? I actually just went out and audited it again, because the first year I went out, my mind was just completely blown. And then the second year, I felt like I was able to really master a lot of the things that they talk about. But it's really cool when you look at an athlete and as a patient from a holistic perspective, as a person, and not just what they're presenting with. And that's really how their model works. And I know that there's like different opinions out there,
Sure.
but from a medical perspective, I like processes, I like diagnostic tools, and I want to see us go through certain steps. And I know that your players want to too. They want to see it progress. And that's something that TPI, with all their data, has. And from a medical perspective, that's the best of the best. So that's where I wanted to get my training. So, we started looking at the diagnostic processes, having those things that they want to see. And what I love is that they're very aggressive about, if they send you a player, this is what we expect you to do. And that creates consistency. And so I really liked that. We spent a lot of time on the diagnostic side and making sure you're getting things right. And then from there, we had fun. So we looked at like the visual system, we looked at balance, we looked at golf specific movement, the swing characteristics, injury inducing mechanics, really anything that they had time to throw at you. But it's so funny is they start the seminar out and they say, okay, we're going to talk about all this in some capacity, but we need to know what you really want to learn while you're here. And it's going to change every time, because there's just so much information. And
Yeah.
unfortunately, 3 full days just isn't enough. That's why I went back. I'll probably go back again.
That's great. Yeah. I
So
mean,
it's
so I mean,
just a lot of info.
yeah, I mean, and that's really, those are all the bullet points that we want to kind of dig into. It's like
Yeah.
diagnostics. Like, I mean, one of the questions we always ask, instructors, because we want to know their process, right? And it sounds like that's sort of what you're talking about. So to kind of get the conversation going, I guess, is like,
Yeah.
if an athlete comes to you, can you describe sort of how you take them through that first session? And I'm sure that's a lot of what you learn at TPI, right? It's like I
Yeah.
mean, do the screens change? I mean, I know the general screens that we take our golfers through. And I know my favorite ones that sort of illuminate some of the swing faults or just swing characteristics that we see players make. Like, take me through that process.
Yeah. So it depends if it's like an actual player or a patient, but either way, I'm incredibly thorough. My like consultation alone is usually like 15 to 20 minutes, and that's just getting to know you. I want to know your health history, your injuries, your previous sports, what previous doctors you've seen, what advice you were given, what your coaches are saying. I want to know your stats. I want to know everything,
Oh wow, yeah,
because I don't want to leave any detail left unmarked. And it's funny because those are things that I'll bring up later on as we're getting somewhere. I'm like, okay, we're getting held up here. Let me go back to my notes and see why. But I really want to understand why an athlete moves the way that they do, why they might not. I have athletes that switch sports, and I had one athlete who was a former hockey player, and I know he had a ton of injuries coming in, but I wanted to know all about him. So, one of my favorite questions that I ask all my patients is to go through each joint of the body and tell me a health history, which is hilarious because they think they've told me everything, and then all of a sudden they haven't.
Sure.
And I get a
Yeah.
full life story.
Yep.
So that's one thing that I do. And then from there, we do like a TPI level 1 screen. We do the basic things that are all across the board always the same. And where I get to be
Sure.
creative is in my treatment. So that's
Well,
really
tell me
what
about
happens my
that.
first visit. We do all of our screenings. I do my
Yeah.
orthopedic
Yeah.
testing. I make sure there's no need for imaging or any diagnostic testings. We got to rule out the scary stuff, of course, and then go from there. And then part of my favorite is when they come back in and we look at all the information and we come up with the plan. I love programming, and that's where I like to talk with the coaches and talk with their strength training coaches and see what's needed and support the athlete from where they're at, where they want to go, and then what's also best for them and their body and what they're capable of. So
Yeah.
it's a process.
Yeah, for sure. Yeah. There's a lot to unpack, right? I mean,
Yeah.
I didn't know how much, I know you're not, I guess, a trainer, but I mean, I'm the same way. I'm like, people are like, well, what exercise should I do? I'm like, well, I always say I'm not a trainer, but this is, I've spent enough time with people
Yes, you
that,
have the knowledge.
right, general knowledge, right? I mean, we don't try to take their jobs, but I didn't know how much, because I've seen pictures of you like in the gym, like working with some people, right? It's like, I kind of look at you almost, don't take offense, like the
No,
female
it's
Dr.
hard to
K.
offend me.
No, but I mean, it's just a compliment. But like
Yeah,
I've pointed you toward Dr. Mike K, which is one of the best that I've ever
huge
been
honor.
around. Yeah, absolutely. But yeah, and I kind of look at you the same way as, with all this knowledge. But you have to kind of dig in, especially when you're dealing with golfers or just any sport. When he's working with
Yeah.
baseball players or whatever, you kind of have to have some general knowledge there to sort of assist that. And I was curious of how much you do in the gym, or how much exercise physiology
Depends on
stuff
what
you
the
do.
goal is.
Yeah.
I treat in a mindset of, we call it 3 R's. We need to reset things that aren't moving or things that have an issue, whether it's musculoskeletal, nervous. That's where the adjustments come in. And although I'm a chiropractor and that's my favorite tool, I love a good pop and crack. That's not what we're doing. We need to reset the joint. We need to turn it back on and back off, or off and back on. And then from there, we need to do something with it. And that's, going back to my old job, it's where I was like, there's something missing here where,
Mm-hmm.
people aren't getting better as fast as possible and things aren't sticking around. There's that typical misconception with chiropractic and even PT of like, I went a whole bunch of times and I didn't get better. And it's because we're missing those reinforcements, which are, we did an hour worth of care. Now I need you to do this at home and I need you to do this exercise. And then from there, once we get that mobility back, or we get that new swing movement, we need to retrain your brain to be able to reproduce it. Because if not, it's just a movement. It's not a pattern that you need to be able to reproduce. And it's fine, there's the classic stepping up to hit the ball and you've got all these swing thoughts, but in reality, in playtime, that is the last thing you need to be thinking about. If anything, you want to be enjoying it or thinking about strategy. So taking the movement, taking what we've fixed and doing something with it to the point where your brain can actually use it going forward. So that's where you'll see my exercises. And I always joke, we always feel like we have to do these crazy exercises, but I often bring my patients back down to the floor and we get into primitive movement, because if you can't even control your lower back, how am I supposed to add rotation in or add power in? So it can get crazy, but it can be really simple too. And it really is just meeting the patient where they're at and what they need.
Yeah, that sounds just like Dr. K. It sounds like Dr. Bull, that you probably, have done a little research on
Such
as
an
well.
honor.
Right? Yeah. I mean, it's like, it's like getting on the floor and doing, baby crawls and doing like just,
Yeah.
like general, like it doesn't have to be, crazy exotic stuff that you see some of the tour players doing on Instagram.
We call them sexy exercises. They look
Right.
cool, right?
Yeah.
But if you can't even roll over, or you can't even crawl and do a cross crawl pattern,
Yeah.
why are you bothering balancing on a Bosu ball with a kettlebell and a band and all these things? I teach some dancers, some strength and conditioning coach on Tuesday nights, and the first thing that I did with them is had them roll over, and they were crying, laughing, but none of them could do it. And I was like,
gosh.
You guys are competitive dancers. You have to control your movements and control your spine so you can move around it. And it was just funny to play into the humor of it, but also the seriousness of it. So yeah, movement is very, very important. But if we don't teach our brains how to use the movement, then we're wasting our time, really.
That's awesome. Yeah, I'm gonna ask you a couple of questions that I asked Dr. K.
Oh boy.
Right. Yeah, and it actually reminds me of, I remember I sent you a text a while ago when Tiger came back right after his ankle being fused. So we'll talk about that here in a second too, because I loved your answer.
Okay.
But just a couple of things, and it kind of piggybacks on what we were just talking about. But the biggest mistakes rotational sports athletes and coaches make in designing a program. What would be your thoughts on that?
Ooh. Well, for me, working with youth level athletes, I think my first thing that I look at is equipment, especially with my baseball players. It is too long, too heavy, too soon. And often I'll see like, my younger kids come in with their dad's old clubs. I'm like, what is happening? So that's one of the biggest things, because if you don't have stability and you don't have strength to support movement, and then you put torque into it, you're going to have my injury. I can't sleep at night about that.
Oh boy.
So the biggest thing is, especially younger athletes and even older athletes, because to be completely honest, most adults can't control their core either. But if you can't provide stability around your axis that you're rotating around, it's not a if, but when. So that's kind of my thought on it. I want to see that you can actually maintain a base so you can generate power and you can generate an effective swing.
Love it. All right. The pitfalls of over-reliance on bilateral strength and motions.
Oh,
I know it's a big topic, but
I know.
Anything like that comes to
Say
mind.
it again. Let me make sure I got this down.
So the pitfalls, right? So what's the problem of over-reliance on bilateral strength and motions? If I'm thinking that means like doing deadlifts, right? I mean, or, there's a lot of weight training. I mean, I know it's like you said, looks sexy, but how much can that affect? I guess probably going back to like TPI, it's like being able to move, right? I mean, it's like, it's great to look buff, but if we can't move and do our job, and that's what Dr. K talks about a lot, it's like we can't actually move a golf club fast, then it doesn't really help us.
Right. Well, the biggest thing is that there is need for it. Your glutes are the king of your backswing. You need to develop that power. And I often see people not training it enough. But I also see that they focus too much on that and they're not focusing on unilateral movement, which I think is what the question's kind of getting at. I think the biggest thing is that we're generating power and transitioning it laterally. So if you are focused front to back, which is really important for creating that stable axis, that's important. But if you're not able to then translate that to rotation, then we're going to have a problem. So when you're focusing on that bilateral singular movement, you're focusing in one plane. And we know that golf is 3 planes. So that's really where I think people over rely on one position. I even see it with like runners, right? Like they focus on going forward and going backwards, but then I don't see them training laterally enough. And it's really just to support the ability to resist emotion. Like for me, when I go into my backswing, I am flexible, I am bendy. My problem is not rotation. I guarantee it. I can over rotate. I have the external rotation of an MLB baseball player, but I have to work on reducing that. So that's where I do a lot of singular training and unilateral training, really not necessarily to increase strength, but really to increase the ability to resist accessory motion we don't want in the swing. So I don't know if I answered that well, but
no, I think it's fantastic. So tell me about your game. Where are we at with your golf?
I need to take a lesson. That's where we're at.
You need to come.
It's either I would love to. It's either really good or really bad. So sounds like golf. What's been fun is because I understand movement. I didn't really play growing up. I've been able to develop my movement around what I know I'm capable of, and I have my injury history, so I can kind of program myself. I think people often are surprised at my swing when I tell them I've only been playing a year and a half. But I mean, I can
new to the game.
Yeah, I mean, I'm really good at sitting in the cart. I'm a great caddy. I'm great at strategy. I've always sat there and watched the Golf Channel with my dad, or actually gone out and watched my husband play. I tell him all the time how lucky he is that I actually enjoy going out with them. But it's fun. I can generate a lot of power when I do it right, and that's always surprising. And I'm getting a lot of practice on my short game.
Good. That's great.
One thing I know is I'm not a good visualizer, so I have to really focus on my putting game and focus on aiming a little bit more. But surprisingly, I'm not too bad. I'm hopeful. I have some good goals.